Hospice simply is patient-directed healthcare at the end of life.
At the end of patients' lives, they want all different things, but many people want quality of life instead of quantity of life. They would like to live whatever days they have left in the best way that they're able, and hospice enables them to do that by giving them options to deal with their physical symptoms, their spiritual, their emotional, their psychosocial concerns, and to still get their clinical needs taken care of.
It's a different avenue of healthcare that patients that are facing end of life or a life-limiting illness can pursue as a course of healthcare or treatment. And hospice is able to bring comfort to the patient.
What a hospice can do is, let's say we're coming in with the nurses and we're coming in with the aides. We're not only alleviating the staff work that they have to do, but also help provide that bridge that people are more comfortable, so maybe they're less angry, less critical. Financially, obviously, there's benefits in that hospice is providing those medications or supplies that are necessary for the patient.
We have a program called the Ultimate Gift Program. We are able to provide gifts of a day for our patients. We had an elderly lady that come onto our service, speaking with the daughter and developing that rapport and talking about how her parents had met. They had met at a Buck Owens country music concert years and years ago, about 50 years prior to that. And it just so happened that that was their very first date, and he was coming to town. So we were able to get the mother and her husband to the Buck Owens concert, and that happened to be their last date.
If I'm a long-term care facility, I'm looking for quality of personnel. How often do they come? How long do they stay? What is the actual hourly benefit that my resident's going to get from this hospice? Is it 1 hour a week? Is it 45 minutes? Is it 5 hours? You know, those are the things that you could really judge a hospice on, and all of them are different. Everything I'd done in long-term care, being an administrator, overseeing 4 homes, had led me to certain care beliefs that I saw some, call them weaknesses or left out parts of the new OBRA law and the MDSs, and it really made me think that there's a better way to deliver care in long-term care for one. So I started Crossroads, and that was 1995 in a breakfast nook in Broken Arrow, Oklahoma. I'm happy to say that in 16 years, through Medicare cuts, through this or that, or steeper regulations, we've only added to the program. The residents now are getting a better level of care than they were when we got started, and it's really, really exciting. The philosophy is expect more.